Hello.
Okay, everybody. Good morning.
Good morning.
I'm Carlos Donovan, the Executive Director here at East Cleveland Public Library. On behalf of our Board of Trustees, welcome to our amazing facility. East Cleveland Public Library is a school district public library governed by 7 board members led by our board president, Mr. Zakib Rashid, and I'll turn it over to him.
Good morning. I'll be brief with my remarks. As he said, I am president of the Board of Trustees for the East Cleveland Public Library. I have a fellow board member here with me, Dr. Cassandra McDonald. She's the chairman of the Finance Committee for the library. But welcome the Greater Cleveland Association of Black Journalists. We're very happy that you decided to hold your meeting here today. We're a very integral part of the community of the city of East Cleveland. We're expanding our library to offer a lot more space and programs for the library. So I'm not going to hold you up. I just wanted to say a hello and thank you for deciding to have this forum at our library.
Good morning. Good morning. My name is Kevin Chilhurd. I'm the president of the Greater Cleveland Association of Black Journalists. And for this auspicious occasion, I wore my full-out T'Challa dashiki. We'll make that T'Challa. I'd like to welcome everyone for coming out. If we have various members of the GCLEABJ in the audience and on stage, please raise your hand. All right, thank you very much. This forum is part of the Connecting the Dots Between Race and Health, a project of Ideastream Public Media founded by the Donald J. Goodman and Ruth Weber Goodman Philanthropic Fund of the Cleveland Foundation. We would also like to thank the Cleveland Guardians, and that's the COVID-19 hesitancy team, not the new name of the baseball team, which many of you may have seen me in a lot of those ads and commercials. Also Fomico's Foundation for their generous contributions. I'd like to take the time to introduce our moderators. Ivanka Hall, Executive Director of Northeast Ohio Black Health Coalition. Ivanka is a prominent community leader in Cleveland and serves on numerous boards and committees. The 1974 murder of her mother, Yvonne Boston Hall, dramatically changed her life. Her childhood promise to use her life to help others has led to the creation of cutting-edge programs and has impacted thousands of people's lives. Also, we have my sister, Rhonda Crowder, GCLEABJ Vice President of Print. Rhonda is a journalist, author, entrepreneur, and literacy advocate. She is passionate about finding solutions and the advance of the African American community. We also have Ms. Stephanie Phelps. She is the GCLEABJ Editorial Committee Chair. Stephanie is a journalist, talk show host, producer, and communication specialist. Her motto is, "I'm all about the people." At this point, I will turn over the mic to Sister Hall to get us started with today's program. Thank you all for being here.
Good morning. Good morning. And welcome. Hopefully my voice will hold out. You know, I have some issues at times. So I'm here to give you the historical perspective around the piece that we're going to speak about today. So racism is a system of structuring opportunity and assigning value based on a social interpretation of how one looks, which is what we call race, that unfairly disadvantages some individuals and communities, and unfairly advantages other individuals and communities, and saps the strength of a whole society through the waste of human resources. This is the American Public Health Association past president, Kamara Jones, Dr. Kamara Jones, a quote from her. So prior to the 16th century, race was associated with language. With the enslavement of Africans, race became about the looks of Africans and blacks on the bottom. This brought with it racism. and created a caste system that we still know exists today. There are only 2 times in the United States history that the health status of blacks has improved. The first was after the Civil War. During the Reconstruction era, this is the Freedmen's Bureaus were established in the South and provided health care, medical schools, shelters, supplies, and to formerly enslaved communities. This very act prevented what many southern states had hoped would happen to their formerly enslaved property: extinction. They expected us to die. This was also short-lived. So the Freedmen's Bureau was short-lived from 1865 to 1872. The laws that were created, including the 13th Amendment, which was created in 1865, and other laws soon after to prevent equity in communities that had infant mortality rates that were 3 to 1 and maternal mortality rates that were equally as high. The second time that the health status for African Americans improved was after the passage of the Civil Rights Act in 1964. This outlawed discrimination based on race, color, religion, sex, and national origin. The Civil Rights Act brought with it the integration of public hospitals and community centers. It secured African Americans equal access to restaurants, transportation, and other public facilities. It enabled blacks, women, and other minorities to break down barriers in the workplace. In America, health is synonymous with wealth, both of which minority groups have been denied as a result of discriminatory practices. In between all of this is a system created in the United States to divest in black communities: redlining. Redlining is a discriminatory practice in which denial of credit and insurance, the denial of health care, and the development of food deserts in minority neighborhoods are withheld from potential customers who reside in neighborhoods classified as hazardous to investment. These neighborhoods have significant numbers of racial and ethnic minorities and low-income residents. Redlining has technically been outlawed by the Fair Housing Act of 1968, but we do know that segregation in the United States still exists. Since 1980, the health status of African Americans has declined dramatically. Many of the gains in the civil rights era have been lost. Hospitals are more segregated than ever, with many in poor communities closed or facing closure. Community health centers have closed, merged, and placed services at a greater distance for communities that have transportation needs, and staff that once looked like the community have been replaced with unfamiliar faces, making the familiar link to health lost. In 2016, African Americans suffered a big blow to life status when life expectancy went from 75 years to 72 years, losing 2.7 years of life. Drastic increases in infant and maternal mortality and the continued impact of redlining have had a crippling impact on equity. Black families in America earn just $57.30 for every $100 in income earned by white families. For every $100 in white family wealth, black families hold just $5.04. For African American women, it's $1. We can't forget that during the Depression, when Social Security was created to help lift elder communities out of poverty, agricultural and domestic workers were excluded. So your mothers, your grandmothers were excluded from Social Security. Today, African American women are more likely than men to retire in poverty. The racial wealth gap is the main driver of racism as a public health crisis. Why? Because health inequity in the United States persists today as a direct result of the effects of redlining. The racial wealth gap is found in retail, taxi cab service, transportation, education, online prices, liquor store placements, student loans, credit card access and interest rates, banks, insurance, mortgages, environmental racism, including the impact of lead poisoning, digital access, workforce politics, and tobacco industry tactics. Black Americans experienced a disproportionate COVID-19 burden in the early months of the pandemic and beyond. African Americans were 3 times more likely than whites to be hospitalized, 2 times more likely to die, and Black children were 2.4 times more likely to become orphans. Black Americans continue to experience disproportionate burdens of infection, hospitalization, death, and the incidence of long COVID compared to other racial and ethnic groups. Across the country, local, state, and state leaders are declaring racism as a public health crisis or emergency. These declarations are an important first step to advancing racial equity and justice, and must be followed by the allocation of resources and a strategic plan. This means that calling attention to racism and shifting the narrative in a way that can drive changes in policy, laws, and resources of allocation has to be a priority. Resolutions and formal statements are not necessarily legally enforceable, but they can drive meaningful change. These resolutions create the opportunity for strategic action to eliminate racist policies and practices and to adopt those that advance racial equity. The 10 actionable items around equity that must be committed to our work as we address the crisis that centuries of unaddressed racism has caused and that COVID has shone a light on include data and accountability, community engagement, policies and programs, funding, organizational capacity, training, economic development, education, housing, basic amenities, and the environment, public safety, policing, health, and yes, COVID. Today we are here for Black Health Matters, Greater Cleveland Association of Black Journalists Town Hall Forum on Racism as a Public Health Crisis. I want to thank the wonderful members of the panel for agreeing to come out and to share vital information with you concerning racism as a public health crisis. Your panelists today, some of them will be on the screen, are Stephanie Howes, Cleveland City Councilwoman representing Ward 7. Stephanie Howes is a caregiver, mentor, and public servant, presently serving as Ward 7 Councilwoman on Cleveland City Council. Prior to joining Cleveland City Council, Stephanie served as the Ohio State Representative, educator, consultant, and engineer. Her range of lived experiences keeps her grounded in the realities of everyday people and motivates her to use her public platform to share uncomfortable truths and engage in uncomfortable conversations to make our community, to move our community forward for the benefit of all and not just a select few. Beyond her civic responsibilities, Stephanie enjoys cooking new recipes, watching Netflix, singing, rapping karaoke, and is an ever-enduring Cleveland Browns fan. Tiffany Short, she's the Director of Organizational Effectiveness with the Metro Health System. Tiffany joined the Metro Health System in November of 2018. Under her leadership, Tiffany is responsible for inclusion and diversity, culture and employee engagement, employee recognition, and workforce development. Specifically, serving Lincoln West Science and Health High School. Prior to joining the Metro Health System, Tiffany led client organizational and leadership development for Corporate College, a division of Cuyahoga Community College. She engaged companies in change management and performance consulting role in the development and delivery of holistic talent solutions to meet unique business needs. Dr. James Brown, MD, is a native of Cleveland, Ohio. He's a graduate of Howard University and the University of Toledo Medical School. He trained in gastroenterology at the Cleveland VA and University Hospitals of Cleveland and practiced for 30 years before retiring. He started a practice incorporating traditional Chinese medicine, Ayurvedic medicine, nutrition, yoga, Oolong, and allopathic medicine, and introduced these modalities to the African American community of Cleveland before retiring again. He now practices internal medicine on a part-time basis at a federally funded community clinic. He'll give you the right names of those things. Sania Bray is co-facilitator of Black Environmental Leaders. As an environmental leader, Bray focuses on energy and with particular regard to renewable energy, waste reduction, and electric vehicles. Jasmine is not here, but just in case she walks in, I'll introduce her. Jasmine Long is the president and CEO of Birthing Beautiful Communities. Birthing Beautiful Communities is a nonprofit dedicated to transforming lives and reducing Black infant mortality by matching women with a doula and a prenatal support team member from their neighborhood at no cost. Jasmine believes that if our babies aren't doing well, our communities aren't doing well. And that is why Birthing Beautiful Communities works to reduce the internalized stresses caused by problems with employment, housing, and education. Vicki Dansby, cancer survivor. Vicki is the executive vice president of Imagine That, a Cleveland and Los Angeles-based marketing and event planning firm, and founder of Abundant Lifestyle Wellness brand. She also serves as a board member of Leading Ladies Inc. and the fund development director of United Black Fund. Vicki recently moved to Geauga County in Amish country, where she discovered a better quality of life. Thank you to all of our panelists, and I look forward to our discussion today and our next moderator.
Good morning, my name is Rhonda Crowder. I am the Vice President of Print for the Greater Cleveland Association of Black Journalists. And before we get into our discussion, we want to hear from Vicki Dansby. We want to hear her story about how she's been dealing with cancer.
Good morning. Can you hear me okay?
Yes.
Okay. Hi, thank you guys for having me today. Well, as Rhonda said, I'm Vicki Dansby, and I am a native Clevelander. I've been in Cleveland all my life. However, in January of 2020, I was diagnosed with a rare form of breast cancer. At that point, when it was discovered, it had metastasized through most of my body. I wondered how it came to pass because I didn't have a family history at all of breast cancer, and I was told that it was environmental. So being told it was environmental, it caused me to question everything. I mean, everything in my environment where I was living. At the time, I was living in Euclid, Ohio. However, we weren't like really, well, we were in the city of Euclid, but we were on the lake shore. So we weren't like, you know, smack dab in the middle of like city life. However, there were electrical poles around my house. It was 5G towers at the corner. And most importantly, it was a lack of easily accessible, clean food. So it was a lot of fast food. It was grocery stores that didn't carry organics. Or if they did, they were not fresh organics, basically. So while questioning the environment and figuring out how I was going to survive this, we decided to just sell our home and move to an area that was more susceptible to my survival. So where we moved to is like in the middle of Amish country in Geauga County. We have working farms, at least 3 of them within a 3 to 5 mile radius, where we can get organics, we can get organic meats. There are literally like no electrical towers in my community, in my neighborhood that's close by my home. I don't think I've seen a 5G tower. I was kind of skeptical about popping in on Zoom today because my Wi-Fi is in and out as it pleases. But that's the cost that you have to pay. And I just feel like that for me, I know that, you know, your destiny is what it is, but I felt that my environment, considering that my diagnosis was environmental, the fact that I was in the middle of the city with, you know, the smog, the towers, all of that, and I didn't have readily available, clean food to eat, it made a difference in my diagnosis, and it has definitely made a difference in my survival. That coupled with traditional treatments, which, you know, I still get today, non-traditional treatments, which has been a total game changer for me. And so it's things like that, that for people who are in the city, more specifically Black people, the information is available on the internet, but if you don't know what it is you're looking for, you'll never find it. So, you know, education is the key for me.
Thank you, Vicki. Milwaukee County declared racism a public health crisis in May 20th, 2019. Then the notion of racism as a public health crisis in Cleveland was examined at 400 years of Cleveland Summit, convened by the YWCA of Greater Cleveland and First Year Cleveland in October of 2019. In an article I wrote for Fresh Water Cleveland, I quoted Dr. Rodney Dunn, Associate Publisher of Urban Affairs and at the time, Chief Diversity Officer at Cleveland State University. And he said that structural racism is not going to be eradicated in our lifetime, but this is the appropriate time to make a concerted effort to have the important conversations. The residual effects of slavery are apparent. Margaret Mitchell, the former executive director of YWCA Greater Cleveland, said descendants of African slaves have experienced significant levels of disparity. When you look, you see. Look at lead, she said. This is a tragedy that has an effect. Not too long after the COVID-19 pandemic emerged, and of course, African Americans felt the brunt of it. Then to make matters worse, on May 25th, 2020, my birthday, by the way, the world witnessed the murder of George Floyd as a result of a knee to his neck by a white Minneapolis police officer. On the heels of that incident and the outrage that ensued, organizations and agencies across the country began to respond. And that's when both the city of Cleveland and Cuyahoga County declared racism a public health crisis. There it is in black and white. Other Ohio cities followed. Today's panelists, now Cleveland Ward 7 Councilwoman Stephanie House, even introduced legislation in the Ohio House of Representatives. As a result of Cleveland's declaration, more than 100 Northeast Ohio organizations signed a letter of support. Since then, a report found Cleveland to be the worst city for black women. The National Urban League says that the state of black America is grim in their recent 2020 report, stating figures on black health disparities, wealth inequality, and more changed so little and so slowly. In a brief in the Cleveland Plain Dealer just 10 days ago, on 420, page A6, column 4, very small one, reported that a recent study found redlining to be tied to more oil and gas wells in urban areas. I can go on. So today, with these declarations as a public health crisis, with these declarations in place, many, including the Greater Cleveland Association of Black Journalists, are begging the question, what is being done? So with that, let's get this important conversation started. I want to start with Councilwoman Stephanie House. Is she on the screen? I think I see her. After Cleveland made the declaration, a working group was established, of which, well, this question was actually directed to Councilwoman Stephanie House as well as Jasmine Long, because Jasmine Long is on the working group that was established. Can you tell us what are the expectations of the working group and what progress the working group has made, and how much does the group plan to spend the $325,000 that they've raised?
Well, good morning, everyone. You're coming out just in and out a little bit, but I just want to clarify to make sure I heard the question correctly. You were asking about what are some of the outcomes from the city of Cleveland based on the declaration they made and the worker group that they had. Is that correct?
Yes.
Okay, all right. Good morning. Thank you also for the invitation. My apologies for not being there, but life is happening. So I can tell you where we are right now, the city of Cleveland. I always say, we are currently in a global pandemic, even though depending on where you go, people don't act like it. And so that really, I know, had the working group that individuals were working on. You have partners from the city of Cleveland, the NAACP, Urban League, and other community partners. It kind of went in a standstill, right? And now with the change in new administration, more additional members on Cleveland City Council, there will be a reconvening of the group. I know you asked about the current allocation that was slated for the commission. We know that's not nearly enough. But I think part of that initial allocation was to help with some of the, I would say, research gathering and really trying to help to look at ordinances, policies from the city's perspective to figure out what better opportunities and ways can the city do the work. Because it's one thing to tell somebody else what they need to be doing. It's a whole other thing of doing the internal work amongst yourselves to be able to make some changes. And I will tell you, just being, 4 months into my service in Cleveland City Council, we have a ways to go, and many times it's a very hard pill to swallow when you have the realization that the entity or the organization that you are a part of has been part of the problem, right? And I think it takes strong leadership to do that. And I'm hopeful now, because I am slated to be on the working group, to be able to, have that honest assessment from the city of Cleveland, to be able to say, have been the shortcomings from how we've been serving our people, but really looking from the guidance of others, from your perspective, from the journalist's perspective, you all literally have years and decades of research that hopefully we can use that can guide us in our work and how we can better, just like I said, change the trajectory of Clevelanders' lives and really, like I said, really just transform this system that wasn't designed from us. That's what I'm looking forward, to getting out of the working group. I know many of us are tired of death of reports and reports on reports, but I feel like it is foundationally important to have working documents so that you can lead to some different actions. So that's just initially what my thoughts are, and I will be more than open and welcome to taking any suggestions that people may have.
Thank you, Councilwoman House. So our next question is for any one of our panelists to feel free to respond. Can or should any of our Black institutions and organizations step forward to take the lead and affect change?
The question is can?
Can or should?
Absolutely. Certainly, I think number one, the public school system, because we all have these bodies that we have. and we're not given a manual on the best way to maintain these bodies. So nutritional education, mental health education, starting in the Cleveland public school systems would go a long way towards helping young people make better choices. In terms of the churches that we're a part of, or the synagogues, or the temples, or the mosques, education on how to maintain a healthy physical body, what to eat, when to eat, how to eat. I come across so many people who are so unaware that the things that they consider healthy are so unhealthy simply because they lack the education. We're not getting it in the school systems, we're not getting it in, and many times if you go to see the physician, I have 15 minutes to talk to you about your blood pressure. I don't have time to talk to you about your whole diet because of how my schedule is scripted. So you have to do some work on your own, but it would be nice if the social institutions in the community took this upon them and start having speakers come in and talk to their congregations about how to eat better, how to exercise. Ms. Dansby brings up the environmental concerns. We should know that by the year 2030, 1 out of every 2 American men will have cancer. 1 out of every 3 American women will have cancer because we live in a toxic environment. She mentions the cell phone towers, the electrical grids. We carry our cell phones on us. All of this disrupts the electromagnetic energy that we have, which leads to other disease factors. We have to be taught these things, and we have to be given solutions on how we can rectify these things. So yes, they can and they should.
Yeah. I'm sorry. I think I agree with everything that you said. I think that there is an opportunity for everyone to get involved, though, and I think these anchor institutions need to partner with these Black organizations in order to make a difference. That's part of our obligation, or should be part of the obligation of those organizations, because it can't be done alone. And I think just obviously there's some opportunities for us to empower ourselves and take the lead, but I do think that we also need the support of a wider network.
So I agree wholeheartedly with those who we share this conversation with today. Do you need me to come closer? Or you need to go back? Come closer. Okay. I'm not used to sitting in this angle, but I can make it happen. So I agree wholeheartedly. That was a very big question that you asked. Let me start by saying peace and ease to everyone in the room today. We've received a lot of information that we know in our bones, information that is a health crisis in and of itself. The fact that we live and our lived experience entails all of the story that you all have shared today, and that we carry that within ourselves. As we think about, for me, as I think about your question about should the anchor organizations get involved, the short answer is yes. I also like to impart upon and ask each one here to consider, though, another component to that question, and it is this: we are they, and they are us. It is a human desire to say somebody else should fix it. Somebody else should make it right. Somebody else should fill in the blank. However, here's the part that I have found to be very interesting, and there's 2 pieces to this. The first piece that I found very interesting is that as I am saying somebody else should fix it, somebody is looking at me and saying, I am the they that should fix it. So I come to the conclusion that I'd like to put on the table for consideration as we have this continued conversation is, yes, they should. And if the they is us, then that means we should. Each one of us make decisions every single day about what we put in our body, what we breathe, where we live, and these choices. And Vicki exercised her agency to choose an environment that would respect her body. All of us don't necessarily have the choice to move, and we may not want to move. And there are others who impact our bodies in ways that they should not. However, I still believe that the answer lies with each one of us. The answer lies with each one of us. The decision that I make today will determine what my tomorrow looks like. The decision you make today will determine what your tomorrow looks like. My colleague here talked about education. Each one of us can get education about anything that we want to know. The question is, do we choose to? My colleague here said, well, we need to engage it. Each one of us can engage with the information that we learn. Did we do it? So the short answer is yes, but I also like to add a layer to that to say, the bigger answer is, where are we using our agency to impact our life? Because as long as I continue looking outside, and I'm not negating it, right? I'm not negating the people doing stuff they shouldn't do, and putting things places they shouldn't put it. So please do not get that confused. But I am saying, not above. And I am saying, because we are dynamic beings, and as dynamic beings, we can understand that multiple things can be true simultaneously. I know I just upset somebody in this room. Multiple things can be true simultaneously. What do I mean by that? Yes, someone is poisoning our communities and they're doing it on purpose. They've always done it. And so the expectation that somehow miraculously, because a social service organization says stop doing it, they're going to stop, I think is an unrealistic expectation. They're not going to stop. However, we can stop believing that that's the only outcome that can be wrong in our lived experience, and then make choices in our life.
Yes. Yes.
The next question is for Tiffany and Dr. Brown. Does racism factor into the way the healthcare field creates and administers policy?
Yes, in a couple of ways. There's the less impactful way is the interpersonal relationship. So there's a couple of studies that show how physicians are unaware of their unconscious bias. And this is not just white physicians, it's also black physicians too. If you look at the diagnosis of heart disease in black females and the delayed diagnosis, if you break down who the physician was according to race, the delay was just as bad for black physicians referring black women to cardiologists as it was for white physicians. So number one is the physician has to be aware of his or her interpersonal bias, unconscious bias. Then, because that determines my referrals, what kind of medications I may choose, how well I listen to the symptoms. Then there's the structural part that everybody's been talking about. There's the education, there's the housing, there's the economics. You know, we have twice as many uninsured African Americans as we do white Americans. We also know about the cost of medications, your ability to afford even the medicine that was prescribed for you, the ability to get tests based upon your economic status and the kinds of insurance that you have. But back to what my colleague was saying, and again, even though those barriers exist and our access to getting health care, the delayed diagnoses that we have because sometimes we come in later than we should, again, still a lot of it boils down to personal choices. And that's where I think the piece for education is, because if we don't know what to do, how do we make the right choice when it's presented to us? And that's why education on every level about what we should be doing with our intake of various things, what we should be doing about not doing certain things, educating, you know, in various ways.
Thank you.
Want to also answer? So, you know, at Metro Health, I think, you know, one of the things that has been really important to us is really engaging the community around this topic and creating programming that's going to best support the community with them at the table. And so, to your point, yes, we do a lot in the space of unconscious bias training and cultural competency training, real training, which is around race, ethnicity, and language, because we recognize that patient outcomes, require that, right? You have a better outcome if you trust your provider. What that patient experience is like from the moment that you step into our doors until you get, home, right? And so we understand that if our patients don't trust us as a system, then they're not going to take the actions to do everything that they're supposed to do that's outlined, with that physician. And so, a lot of our policies and programs are driven around just that. How can we increase the patient experience and make it a better one so that they're doing their part in this? How can we provide more health education and awareness to the community so that they feel empowered? And then I would say the other piece is a lot of programming around how can we meet people where they are. So I think it's important as an institution that we take a critical look at ourselves, right? Yes, we're in this brick and mortar building, but at the end of the day, you can come to us for care, we'll give it to you, but we have to get out to the community. We have to get to know our patients and the community better. We have to provide resources and access to health care because we can't just make the assumption that they're going to come to us. And so we use that as kind of our roadmap to say, okay, are we putting forth the right policies and programs based on some of that framework?
Thank you. Samia, can you give us a brief overview of how environmental injustices are contributing to poor health outcomes, particularly in minority communities, and what immediate environmental issues should be addressed to improve public health?
Okay. I'm gonna need you to tell me a couple of those pieces, because there's something that I need to say to this audience in vulnerability and truth. 4 years ago, cancer chose to visit my body. And the way that I found out is I was getting dressed, and I noticed what looked like a really cute little string of pearls right here on my side. And as I looked at my body, I said, I don't think that belongs there. Now, I have a schedule that's just as busy as everybody in this room. Y'all know what the first thought was. Oh, I'm too busy. I don't have time to make a doctor's appointment. I just need to get to this next meeting, get to this next thing, make sure I make it to the next whatever. But it was like say, this bottle of water, if you walk through your house and somebody put that bottle of water in your living room, you come home from work, you walking past the living room, you gonna stop and say, wait, who put that there? That didn't belong there. That's what I felt about this little string of pearls, just a little bitty string of pearls. 3 little strings under my skin. The second thought that I had is my mama gonna kill me if this is real or this is something and I don't say something. So guess which one won? My mama gonna kill me. If this thing is something, I'm thinking it's nothing. My mom thinks if I don't say nothing, my mama gonna kill me. If it turned out to be something. That's why I called my doctor. I went to my doctor. My doctor said, oh, it's probably nothing, but we'll do a biopsy. And I said, okay. So we did the biopsy. They removed it. That doctor said, oh, it's probably nothing, but we'll let you know the results. And if you hear from us, you'll know that it was something. And I said, oh, okay. Then I got a call, thank goodness, I guess I got okay insurance. I got a call from the oncology department. And the oncology department said, we're calling to schedule your appointment. And I said, wait a minute, I know what oncology means. For what? And she said, for your follow-up radiation. And I said, radiation-free what? She said, they didn't call you and tell you the biopsy was positive for cancer. I said, no. She said, oops. Now, there is nothing like hearing over the phone, cancer has chosen to visit your body. And I said that purposely. It has chosen to visit your body. At that point, everything else wasn't important anymore. I got a call later from my doctor who said, oh, I'm so sorry, I was in surgery and I didn't have a chance to call you yet. No. That was a choice for me to make at that moment. I could be ticked off at him for the fact that he didn't call me and they didn't let me know. But what me and my family did is we got on sync with one another, and we immediately scheduled and we began to move through that process. They told me they were amazed because they said the cancer was so small in my body. They said, were you experiencing any pain? I said, no. They said it wasn't big enough for you to really even know it. I was like, I just knew it didn't belong there. They weren't amazed because they said, you found it so early that it didn't even have a chance to make it past the skin layers of your body. Why do I share that? I share that because we've all made decisions like that, where there were things that were in our body that we knew didn't belong there, but we didn't want to say anything because we were afraid they were going to be something. That's what I mean when I say we all have decisions that we make. That's what he meant when he said, pay attention to your body. Understand that there is nobody outside of you that's going to care more about your health than you. Nobody. Nobody can care. They don't have time. They said they're scheduling back to back, 15 minutes. My doctor say, okay, you got your 15 minutes, it probably ain't nothing. Let me just schedule you something. I know she cares about me. But the purpose of a system is to recreate an outcome. And to do it with perfection. Until those systems get transformed all the way to their root, we're going to continue to receive these things. I don't tell you those things to discourage you. I tell you those things to encourage you. Each one of us are touching those systems at different places. Do what you can at the location where you are about those systems to transform them. And there was a piece of your question that I don't think I touched yet. So if you could just give me that other piece around environmentalism.
How environmental injustices are contributing to poor health outcomes?
Sure. So environmental health injustices are contributing to poor health outcomes because it is stress from all of those environmental factors on top of each other, right? There's the stress of being overworked. There's the stress of being poisoned by your air. There's the stress of being poisoned by your water. There's the stress of not using renewable energy to reduce your light bill. If your light bill is 50%, 30% of your income, you can't function because you're trying to figure out how your light is going to stay on. If your gas bill is a significant point, if you add them all together and they're more than 50%, you can't figure out how to move forward. That will turn into cancer and other diseases within your body because that stress presents a chemical reaction. That chemical reaction now continues to poison your body. And if you are not adding water, if you are eating, and I tell people, hot fries and Mountain Dew are not on any food group. If you are eating food that does not bring nourishment to your body, those things will contribute to the environmental factors. The last thing that I'll say, and I like to use this analogy, everybody in here know what it looked like to see a stocking with a run in it, right? It looks horrible to see a stocking with a run in it. Y'all looking at, what's a stocking? We've been in the pandemic. We don't know what you're talking about. Okay, I'm gonna say some pantyhose or a sock with a hole in it. For those who don't know what a pantyhose are, I'll say a white sock with a hole in it. You know that big toe hole that your toe be popping all out. So you say, Smith, what does that have to do with climate change? Climate change is simply this. Our earth was designed and built in such a way that as we breathe out carbon dioxide, the trees absorb the greenery, the plants, the grass, they absorb that carbon dioxide, and then they give us back oxygen. We then breathe that oxygen, and then we put back out carbon dioxide. There is a balance that our world was created to give us. We in our personness, I'm not going to say in our humanity, I'll say in our personness. We in our personness, because we want to do planes, trains, automobiles, and everything else, we have increased the carbon use so much, fossil fuels, gas, petroleum, all of those things. We use that stuff so much that we put so much carbon in the air that the trees cannot absorb it. The plants cannot absorb it. Since they can't absorb it, it then moves those greenhouse gases to our layer that protects us from the sun on our earth. Right now, ladies and gentlemen, we have the equivalent of running our stocking on the ozone layer, and it's ugly. What that does is that brings the sun's rays to us at a faster pace, at a hotter pace, so that we are now on track. This is why it's connected to health. We are on track for our earth to be over 2 degrees higher than it is right now. We cannot survive with our earth being that hot. We cannot survive. That is a health crisis that trumps all these other things. It's addition to those things, but that's how it becomes. Now, you say, how is that connected to racism? It's connected to racism because all of that carbon that's coming from those fossil fuels are not owned by people who look like us. They're owned by people who see us as data points and profit margins. Renewable energy uses the sun's energy to create that energy we need so we can't turn our light on. Electric vehicles put out no carbon emissions that don't increase the hole in our stocking or our sock, if y'all will allow me to just use that analogy. Why do I say it that way? Because I work with a lot of scientists who give you a whole lot, and I love my scientists, will give you a whole lot of things, but it's time for us as people to understand we are all contributing to that health crisis through our use of fossil fuels. And that is causing a climate change situation that in less than 10 to 20 years, we will not be able to go outside. We will not be able to breathe any air because it's going to be too hot for us to breathe. And the last thing that I'll say as health as a public crisis and racism is we already know that other people don't care about if that happens to us or not, because so much other stuff has happened and they didn't care. I think the saying goes, if it quack like a duck, if it walk like a duck, it's a duck. So, again, we consume a lot of things that cause carbon emissions. Y'all already know what it's getting ready to be. Make some decisions that do less carbon output. Reduce your individual carbon footprint. And encourage other people to do the same. And require those who we are electing, the elected officials, require them to pass legislation. Stephanie House, she over there. We worked on some legislation that will do exactly that. It's called the Energy Jobs and Justice Act. Make sure the legislators that you're voting for support things that are going to create a world that doesn't kill us in 10 to 15 years. This is going to be too hot. And I tease and I say, and all those plants and stuff, you know what they're going to do. We blow ourselves off the earth. And those plants will just grow. I don't know about y'all, these weeds show up in my yard every year. I didn't plant that. Where it come from? They'll just grow right over all of us. Turn us into waste and compost and keep on going. It don't have to be that way. Hold our businesses accountable, hold our elected officials accountable. That's the connection to the environment and race as a public health crisis.
Thank you, Samir. Jasmine, thank you for joining us.
Good morning. Good morning. This was so important for me to be here, and as you all know, life happens, and that's what I got to do by any means necessary to get here. But after hearing your comments, I'll just briefly say I work in the field of infant mortality at birthing beautiful communities, and it is toxic stress that is caused by racism that is killing our black babies, and it is the dismissal and the mistreatment of black women in those hospital systems that are leading to the death of our mothers. And if we don't address those things, we are going, our communities are not well if our babies are not well. And there's no reason that we should have babies literally dying because a mom has so much stress because of the racism that she has dealt with in her day in her life that it causes her to miscarry or lose her baby or have an extreme prematurity baby. And so that racism is tied into the environment. Our communities often have a lot of pollution and things such as that that lead to higher temperatures already that causes our moms to have distress in their lives. I mean, everything is so interconnected and interwoven because racism is so pervasive that it is literally killing us as a people.
And I have a question for you. Can you tell us about, describe the long-term impact of infant mortality on the high infant mortality rates on our community?
Absolutely. I think we all see it, or we may not see it, but the loss of one's child is something that may live with our communities and our families for the rest of our lives and generations to come. Those losses can be so insurmountable sometimes. Ms. Yamanka over here is a grief recovery specialist. We now have grief recovery through our organization because we have not processed so many traumas, so many different points of grief. And it's interesting because the individuals who do this training for us, who teach us to train, are white. And even our grief is different. We grieve so many different losses, so many different ways that you cannot even begin to understand our pain as a community. That pain may impact every single aspect of our lives. We are still doing things that we have been taught through slavery. We punish our children because during slavery time, we wanted to be the ones to discipline our children so that we would be less harmful than the masters. And that's still pervasive. We don't breastfeed our children at as high as a rate as white women because we were breastfeeding everyone else's babies but our own. I mean, so there are just things that are so pervasive that we have still not lost over the 400 years since we've been free from slavery.
Thank you. My final question is directed to everyone on the panel. In what ways are you or your organization working to improve health outcomes and or advance racial equity? If you can provide one or two quick examples, that would be great. So this is the opportunity for you to tell us what you and your organizations are doing.
So at Birthing Beautiful Community, we are an agency of 42 Black women serving over 500 women across Cuyahoga and Summit County. We provide doula services by women who are from the different neighborhoods impacted by infant mortality, and we're helping each other sister to sister. We have never lost a mom in our program. We did not lose a baby in our program until COVID, and that just shows the impact that COVID has had and will continue to have in our program. We've served over 1,000 women. We've been at over 1,000 births, and we have some of the best outcomes for infant mortality in the state and nationally. And we're right here in your own backyard. We believe in this motto of each one teach one. We're gonna do it for ourselves as sisters. And what I do to make sure that I'm not perpetuating systems, every single one of my staff makes at least $20 an hour. At least $20 an hour. All of my admin staff are paid well. We have unlimited PTO. We just got back from a week-long retreat at Nemacolin Resort. Like, I treat my team like the superstar, rock star, amazing women that they are, and that's when it begins to change. And we have to view our communities, and we have to view ourselves. And when we say self-care, we can't just say that. We have to mean that thing. We have to really take care of ourselves, particularly when we're doing work that serves women, particularly when we are confronting racism on an almost daily basis, when it shows up in nearly every facet of our lives. We have to look out for each other as sisters. And fatherhood, so we have a fatherhood program as well. So we're with dad and making sure that they're well and making sure that we make good families, whether that's a mixed family, a blended family, whatever that family unit looks like. We want to create healthy and whole families.
Absolutely. You got me charged up. I'm like, okay. So at Metro Health, I mean, there's a variety of things that I could probably share, but I would say, some of the highlights is really around our Institute for Hope. And so that's addressing social determinants of health. So as you mentioned, and several of us have mentioned, so much of your health depends on external factors, those societal factors. And so we've done a lot in that space around housing, around food access for those food deserts in various communities, and a lot around workforce development. And so I think, as we start to move into the future and really think about, again, how can we make healthier communities, people aren't going to be healthy if they're stressed out about the day-to-day. that they go through. And so where we can not only Metro, but even challenge other institutions on meeting us where we are and continuing to drive forward. Those are things that are going to be helpful to just uplifting the community in general. The other thing I just wanted to mention is around access. And so, oftentimes marginalized communities just don't have access to health care, and that's why going into the community is so important. We just had our Minority Men's Health Fair on Thursday night, to which hundreds of men came out to get screened. And so we know that men, Black men especially, men of color, don't go to the doctor as often, or they'll wait until, unfortunately it's just, they're in a bad situation. And so we're going to do more of that around the city and even outside of Cuyahoga County, just to really bring those opportunities for the community to take advantage of. So.
As Black Environmental Leaders Association, I have the honor to serve as co-director with David Wilson. And we also serve in the legacy of Jacqueline Gillen. Some of you know Jacqueline. Her spirit goes everywhere that we go. We stand as stewards. Let me correct myself. We are aligned as stewards for the built and the natural environment. We work on every area of the environment because our people are being impacted by every area of the environment. We have 5 tribes that represent all of those policy areas. We work at the federal, the state, and the local level. And we use what we call a distributed leadership model. Y'all know what that is. When you don't have enough money, you pull the people together to get it done. And so we have representatives that work in every single area and aspect of the environmental conversation and advocate for all people to have the right for clean air to breathe, clean water to drink, and to know that if they chose to grow their food in the soil near their home, they would not kill it. For more information about that, you can check us out on all the channels, Facebook, YouTube, all of that. That's what we do, ring the bell for economic and environmental justice. All people.
The organization I work for right now is a federally funded inner city clinic. And because it's federally funded, there are certain metrics that have to be met. And so right now we're focusing on hypertension, diabetes, obesity. And to be absolutely transparent, it is not nearly enough. What I would envision is that these federally funded clinics are associated with farmers, such that the farmers can actually bring fresh food to the clinic area, and people can get high quality, low cost food from farmers in the area, local farmers. It would be a win-win. Then there should also be cooking classes, because you can still get something that's healthy and you can destroy it by the way that you prepare it. So those would be the things that I would see, besides meeting the metrics that the federal government has us trying to meet, trying to teach people in ways to prevent disease as opposed to treating it once it occurs.
Councilwoman House, can you give us some quick, brief overview of what's happening in City Council to help advance racial equity and improve health outcomes?
Yeah, so I would just say, I think in this moment, I'm really trying to focus on our ARPA dollars. The next allocation will come in June, and from my perspective, the things that I've been really working to advocate are really based on kind of, I would say, the fundamentals when we are looking at racism as a public health crisis. Of course, our healthcare, housing, education, economic mobility, and criminal justice, what that actually looks like, really advocating to begin to invest more in, I would say, culturally competent mental health, and I would say even I would just say mental health organizations for housing, specifically looking at the city of Cleveland, making the investments to really give access to dollars to Clevelanders who who have been really denied opportunities to not only to purchase a home, fix up their home, and it's really looking into not, the the debt to loan income ratio, as well as credit scores, which those are things that are taken very racist policies. When we look at education, I'm really advocating for the city of Cleveland to look to embrace and even start piloting more year-round schools, specifically in K-8, understanding that many of our children are so far behind, and this current educational model will not serve the needs to our young people. Looking at making investments in, I would say, kind of tied to the housing, when you know a lot of our houses are falling apart, really making sure that we are investing in community-centered contractors, ensuring that they can get the license and the bondings, not only, to compete and go after contracting opportunities to help us fix up our homes, right? Because, home is a level of stability that can lead people to have more upward economic mobility. And then I would say beyond, when we look at our criminal justice system, I really have been trying to enter this space of what more of a prevention model. I'm really trying to push the city of Cleveland to embrace investing more into preventative things, because we are heavily invested in a law enforcement, public safety system that has demonstrated that it has not been working for us. And I know this is going to be an upward challenge, but again, hopefully in working in partnership with everyone there, we will be able to make a better case of having more of our funds, like I said, going into prevention and not just in a policing model that is really proved to be disastrous in the near future and in the years to come. So those are some of the things that Cleveland City Council, I'm only one of 17, but I'm really trying to show that we can invest our money in a very different way to have different results.
Thank you. So at this moment, I am going to turn it over to my colleague to our final portion of this dialogue. Stephanie?
Okay, hello everyone, I'm Stephanie Phelps, and I am with the Greater Cleveland Association of Black Journalists. First of all, and again, I would like to thank our panelists for being here, for your contributions to the community and shedding light on this issue, as well as your intellect, insight, and expertise. So let's get started. Ivanka talked about the past. Rhonda covered what's going on now. And so now we want to talk about what's next. Indeed, the city of Cleveland and Cuyahoga County, to name a few, have declared racism as a public health crisis. I want to start with Dr. Brown and ask him. Can you all hear me? I'm sorry. Okay. I want to start with Dr. Brown and ask, what are your thoughts on how to end the crisis or at least quell it?
Well, as Ms. Bray so eloquently put it, we're not going to change the hearts and minds of those who have a history in this country of treating us a certain way anytime in the near future. So it is up to us to do certain things. Again, it starts at a certain level of holding oneself accountable for understanding what you need to do, how to maintain your own health. Then we have to also work with public officials such that certain policies are put into place. Again, how we treat the water that comes into our homes, the paint that goes into the buildings, the asbestos that goes into the buildings, the pollutants that come from the cars. All of these things can be adjusted by legislation, but they will never take the place of us making choices on our own. Then there's also the ability that we have of electing officials that we hold accountable such that we don't have to pay the highest price in the world for medicines, such that it's a crime to go to Canada or Mexico to get medicines that are a fraction of the cost that you pay for here. We don't hold legislators accountable for looking after our own best interests, and so consequently, those that pay them well get done what they want to get done. I am amazed at, I just noticed I'm the only male, and I have all this very strong feminine energy who are holding it down, and I just want to thank all of you guys for your contributions. So, and also, when you're going in for your visits, go in prepared. Have a list of the questions that you want asked, that you want to ask, that you want an answer to. Physicians are there to help. They want to help. Their time is limited. So don't present your whole long story. Go in with what you need to have done, the things that you want answered, and if they get up to leave, say, please, I have another question. Most will stop. Always, if you feel mistreated, let somebody know. There are patient advocates all over wherever you are that you can let know that I didn't feel that justice was served in my visit today. We are customer friendly, shall we say. That is a big impetus in medicine, to be of service, to be friendly, to be thorough, to be scientific, but also to have a personal relationship with the patient, because as Tiffany said, if you don't trust the physician, the compliance level goes down. The ability to have a good outcome drops when there's not trust. And so the physician is there. Part of it is a marketing campaign. I need you to trust me. So working with the physician's bias, the structural things, the environmental things, those are things that we actually have the ability to do. Some on a personal level, but we all can work together, as Samia said, at our own entry point into the system. You can make it work for you, but you have to have a certain kind of perspective. We have to be empowered. We have to teach our children to be empowered. We have a tendency to focus on being victims a lot of times, and we're not a victim. The timeline of abuse in America is only 400 years. The timeline of our history is over 25,000 years. We are not necessarily the descendants of slaves. We are the descendants of the authors of civilizations, and we should act like it.
And the same question for Tiffany. What are your thoughts on ways to end the crisis or at least quell it?
Well, first and foremost, I would like to say when you were talking about self-advocacy, I was like, yes, you're speaking my language. Because that, a lot of times when our patients come in, they're not asking questions. Or they're just taking whatever information that they're given and they walk away not understanding. And so that's always just a bad spot to be in. And so every time I talk to a patient, I'm always saying, ask questions. Even if no question is a bad question, we'll take the time or do the follow-up that we need to do in order to get your questions answered. How do I think we end inequity in healthcare is the question?
Well, the question is, the crisis has been declared. So
Yes.
Somebody said, yeah, there is a crisis. So how do we end the crisis or at least dampen it, I guess?
I think it's really around all of those social determinants of health, really. I mean, because that makes up 80% of your medical condition, So if we're not addressing housing and job placement, if you're underemployed, et cetera, that's gonna have an impact on your health. So, for us, having affordable housing, we're working on a project right now that we'll launch in October, but we're building a new hospital. But also as part of that, there's going to be an economic development center. And it's in that center where you'll be able to come in from the community to get financial coaching, to get job training, to get information on affordable housing, along with other resources that you might need. I would say probably over the last 2 years, Unite Ohio was put into place. And so that's several organizations, I think it's probably about 160 organizations that can be referred out to. So if you have an issue with childcare, transportation, et cetera, then you can tap into that network. And I think, from an awareness perspective, many people don't know that those resources exist. And so how do we get around that? I think it's around providing access, it's providing education, so that the community knows that those resources are there and have an expectation that we're going to help you. And so I think those are the ways that we have to really start to focus our efforts on, not just when you come in to the ER, right? It's really looking at it from a holistic perspective.
Okay, thank you. The next question, I would like to start with Councilwoman House. Given how government works, which can be quite slow sometimes, how soon do you think progress can be made, and how do we measure the progress? And then I would like for the others to chime in.
That's one of the things. Oh goodness. Progress, we're staying in progress. Is slow. Is very much an understatement. I will say this. I think that's one of the things. Trying to really set up some real goals. And like I said again, speaking very frankly. Being in this space, you can tell that many people, we do not come up with very specific goals because people just like to play politics. We say stuff that sounds good, but when you get to actual numbers to say, well, this policy will create 1,000 new, homeowners in 2 years. That's hard for people to actually do because, again, everybody is always worried about, well, what if we don't get to 1,000? I won't get reelected. And I guess I'm really challenged at times of thinking through how do we get people to embrace not making a goal? I understand, so at least we put out some goals and then we can kind of work through what happened. But if we don't get to a level of specific details on how many people this policy is going to impact, then we're never going to be able to show where we're going to go. And I think I just feel like initially, getting people to embrace in a very tangible way with numbers, this is the goal for this year. You know what I'm saying? Or this is the goal in the next 2 years. And I really think that the goals need to be set based on individuals' elected terms. In our case, it's 4 years. So we should be able to set out some real goals and measurements. And it is a way for community members to hold us accountable. But I think that is it's very scary for elected officials to do things, to put yourself out there. And I don't know if we'll actually get there. I don't, because people is not the way that many of us have been trained to operate. But I guess this is an ask or a request for those who are there in the room. If you all have any suggestions on ways that we can build the confidence in our elected leaders, and particularly to give some real goals. I think there was one person, Dr. Brown, that indicated how you got hold legislators accountable. I think this is one of the things where if we don't have the millions and millions of dollars to put people in office, have a real partnership with people to better hold us accountable. It's just hard for people to do that. So I don't know when something will happen. I just know that if we don't start setting better benchmarks, we will continue to play this game of coalition here, paper here, working group here, and nothing ever gets done.
Okay, thank you. Thank you for that. Does anyone else on the panel want to speak to that question?
So I'm on the city's Mason Public Health Crisis group that was formed, which is crazy. In 2020, time is flying by so quickly. And I think that's exactly what we're asking for, Stephanie. This is my councilwoman as well, and we're fighting so hard. It's the people like her that gives me hope, because so often our grassroots organizations have not received the funding we need to be successful in the work that we need to do. But we have the outcomes, the metrics, and all of those things. We may not have sometimes the relationships. And so when you get those fighters like Councilman House here, that's where we're going to start to see some real change happening. We're going to see some strategy around giving. We're going to see some strategy around, listen, maybe we don't meet the goal, but at least we need to have something to work towards. And I think with this new office that Tyson Mitchell is going to be leading up, that there's some exciting energy that can happen at the mayor's level. So I think that we're at a really unique precipice for our city. And if we do not take advantage of this momentum that we have right now, we will have failed our communities, and we'll see it for years to come.
Thank you. Okay, so I want to get in one more quick question, and then we are going to try and take some questions from the audience. So this is a question, and I would like to have everybody go around really quickly. How does structural racism and bias play a role in the healthcare system, and what policies can be put into place to help change that?
There are studies as recent as a year ago that show that white physicians still believe that black people feel less pain. And as such, if I say my pain is at a 9, they're gonna, in their mind, say, oh no, she's at a 4. And that impacts how we're treated explicitly. So we provide doula services. We do that. Oftentimes, clients will go to the doctors and will have a burning question, and they'll wait till their hand is on the door to walk out to ask the most important question that they've had the entire time. And so we have to work with our clients, we work with our parents, their parents, because this is for every hospital visit you have. You said it. You have to go in knowing the questions you have to ask and to get those answered and to feel respected and dignified. So those are the things that we're trying to do, is to empower people. We can't change hearts and minds, but what we can do is educate our clients and our communities to ask the questions that they need to ask to be well.
I would say on the flip side for us, we're focused on a lot of training to our staff, right? So whether you're a frontline person to the clinicians, admins, housekeeping, really to understand that there are cultural differences and we need to be aware of that, and we need to treat people in a respectful way. And so that's first and foremost, because those patients, again, won't come back if they don't feel valued and respected and trust the healthcare system.
I'd say for us that it's comprehensive clean energy policy that is at the federal, the state, and the local level, complementary of one another.
Thank you.
How does structural racism affect health? Well, Tiffany keeps referring to the social determinants of health, your economic status, your education status, housing, and the environment. Those factors fuel what is called a fight or flight response. When you're under a fight or flight response, your body starts producing chemicals which alter its physiology. As you go through financial crises, as you're having problems with housing, as you are having problems with your employment, or if your education level hasn't given you the employment opportunities that allow you a reasonable level of security in your life, your body is flooded with adrenaline, your blood pressure goes up, your heart rate goes up, the amount of oxygen to your brain drops, your Your ability to reason drops. You keep doing these things over and over, day in, day out. What happens is your internal organs age much faster than you do externally. So you're dying from the inside out. The ability to modulate your emotions, the ability to maintain a certain equilibrium in life is key to your longevity. Until we can teach people how to do that while we are working on the social determinants of health, we'll keep having the same outcomes.
Okay, and then, thank you so much, thank you. This is the last question that we have to get in, so I'm going to just read this verbatim. Now that the city of Cleveland and Cuyahoga County have declared racism a public health crisis, who should be held accountable for advancing racial equity, and what should they be held accountable for or to? We'll just go around quickly again, if we can.
I think it's the responsibility of our mayor, it's the responsibility of our city council, and they should be held accountable by us, by people in the communities who live here.
I would agree. That's how I would answer. Yeah, I agree.
Ms. Brave mentioned that they are us. And so, yes, it is us as we hold those in office accountable, but we have to hold them accountable. We have to take that responsibility.
And last point on that question, how do we do it? Does anybody have any ideas how do we?
Vote them out when they don't produce.
That's it.
You know, Ms. House was referring to how politicians find it difficult to take positions or do certain things because one of their goals is to be reelected. And we hold that power of electing them. So if they come to us or we go to them and there are these policies that we want done, and they say, okay, well, we can do X, Y, and Z, and they come up with just X, and we don't find that that's, enough, and we think that more could have been done, hold them accountable by not voting again.
You know, I also think too, though, the community has to be engaged, right? And so as part of that, and as Ms. House was saying, what are those goals that, they're going to set? The community has to be at the table to help define that. And I think the community would also have some grace when we fall short of our goals. But we want to know that progress is being made and that we're making the steps in the right direction. We're not going to always hit the target, but we need to at least know where we're trying to go and what that target is. So I kind of feel like, it goes hand in hand. We don't want someone telling us what the goals are for us, speaking for us. We have to be at the table as well.
Okay, so thank you again, panelists. Everybody, please. If anybody has a question, you can come up to either side of the microphone and ask your question.
So thank you guys for this information. This is absolutely fabulous. But I have probably a run-on question or something that I want to kind of get off. First off, I do want to agree absolutely with all of you guys. This is absolutely our responsibility to find out the information that we need to know in order to better our health. But a lot of times when we go into the doctor's offices, we go in and we're having a one-on-one conversation. So if you go to a doctor's office and you don't have information that says that they are more likely to give a black woman a hysterectomy than a white woman for the exact same problems, or that they are more likely to amputate the leg of a black person than they are of a white person, and we don't have access to the information to make comparisons about how we're treated as opposed to how others are treated, we go in already in the dark. And how do we find out, or who do we get to, and I think this goes beyond a second opinion, but who do we get
that tells us exactly what it is that we should be expecting and how we should be treated. I think when you don't know, when you're only you don't know, right?
You don't know.
Right.
Until you know.
And so how do we combat that other than just, how do we combat that? That's my.
So that, I mean, that's a part of what we're doing with the doulas, right? So I wish that we could have, we're there for labor doulas. We do go to our clients' appointments, so we're educating them about their health and their wellness and all those things they may not even know about. But we need that in, for Black, we need that in every aspect of healthcare that we're in. Literally, for the questions. People are so terrified to ask a question for fear of sounding like they don't know anything. They're so scared that they will leave their health and not do what they want to do because of fear. And so we as a community have to start to shift up. Think about it. I just did this for my own self. We had a panel. And I never thought about the fact that I just got a primary health care doctor last year. I'm 31. Why don't I have a primary care doctor? Because you know we have an OB or midwife, and we have urgent care. I mean, that's been my logic, because that's what I saw growing up. I mean, I'm not sick, and I don't need to go to a doctor. I mean, but I had to, and I do this for work. And if I didn't, I don't even know if I would have that mindset shift. Like, we have to start shifting our mindsets as a people.
I was gonna say, I think too, I mean, yes, you don't know what you don't know, but there's, you know, if you have external resources, not even just the doctor, right? Your family, talking to them about what you might be experiencing and getting some ideas on what questions you may need to ask if you hadn't thought of those questions. Internally within the organization, though, there are resources available, right? You have your community healthcare workers, your patient navigators that you can tap into to ask questions if you don't feel comfortable talking to a doctor. But I would say, you know, I agree with you. We have to shift our mindset. When I go to a doctor's appointment, I'm like, I'm gonna ask 3 questions before I leave there, and typically I end up asking way more than 3 questions, but I challenge myself before I go in, and I kind of walk in with an untrusting heart, but I think we have to move in that direction where we have to realize that we're empowered, and that I believe one of you said that no one cares about your health more than you. So you have to take that time. And I know the doctors probably hate when people come in with going to Google everything and they've self-diagnosed themselves, but we talk to our doctors about, would you rather that, so that they have some ideas that you could then, continue the conversation forward. And so, yes, there's those time constraints of the 15 minutes or 25 minutes, whatever the allocation is, but, we're really trying to even shift the mindset of our clinicians to say, we know we have a target, that you need to see X number of patients, but if that moves, then that's just gonna have to be okay.
Well, it's not so much of a question, but it's kind of an observation and a statement, thinking about our relationship to this country and realizing that from the very beginning, we have been in a war zone. We've only really came to the realization of how deep that war is over the probably last few years, maybe 10 years or so, and understanding how deep it really goes. We're living in a country that people set up for a totally different group of people, and they look at us as the enemy. It is going to be up to us to develop communities and spaces and places where we can control our own narrative as to what happens around us. Suppose I told you that there was a place that was only 3.5 square miles, had its own school systems, had its own police departments, fire departments, city hall, had its own library, and it was 90-something% made up of our people. You would say to yourself, well, where is that at? You're sitting there right now. But how do you take that information and say, how do we create an environment that we can control the narrative of our health, our education, and all the other social aspects of what will be good for us? It is inexcusable that in 2022, we are living in a community right now where if you look around the city of East Cleveland, that it's in the circumstances that it is right now, and it's primarily because of voter apathy. People don't get involved. They don't realize exactly what it's going to take. A lot of our health outcomes are caused by the psychological aspects of living in these war zones, because this country is a war zone for us. So all I wanted to do is to make that statement and to say that we are responsible for what happens to us. And as part of this community, the East Cleveland Public Library, we are going to do every single thing we can to bring every aspect of what is necessary for us to survive and move forward. We're going to be about that until the day that I leave this planet and the people who are working for us. Because in the final analysis, vision is where you are going, how you're going to get there, and how long is you going to take. If you can instill those things in a group of people, they'll follow you anyway. But you have to have those, and they have to make sense. We can do that here in East Cleveland, and we are committed to doing just that.
You know, it has been said that some people make things happen, some people watch things happen, and then other people wonder what happened. Thank you. Thank you for your commitment.
We have a question here.
Hey, family.
Hey.
I say family because we are. So I wouldn't be myself if I didn't give just a little bit of data, and then I'll piggyback on what you said, because I feel like all of us have PTSD. And that's what it sounded like you talked about, the feelings that go through your body when you have to go in certain rooms, how you respond to different situations based off what you've been through. And what I've noticed in my experience is culturally we are not giving each other grace. And because of that, we are sabotaging things for one another. I wish Stephanie was still on the screen, because I feel like I've had the most conflict with people who look like me. And I feel like knowing the things that we've been through, knowing how hard it is to get to our next socioeconomic levels, knowing how hard it is to be a black woman, a black mother, a black man, why are we making it so hard for each other? So when I sit in these forums sometimes, I'm just like, I think about all the experiences I've had and how much grace we needed amongst one another. My shirt is real, I'm definitely in therapy, and I think everybody needs a therapist, because we aren't dealing with each other with love. And we can't hold each other accountable in a way and say, the white man this, the white man that, when we do the exact same things to one another. Block, hate, blacklist. And so when Stephanie talked about those coalitions, I was just up there getting activated, but as we were listening to you up there, we were all like, amen, amen. Because all of it is PTSD, right? Like, I feel like we're all suffering from that. The data that I wanted to give everybody, and I do still have a question, is because I'm a former foster youth, when I come into these rooms and I think about the most displaced African Americans in our city, and that 76% of them are mothers before their 21st birthdays, it's predominantly black women who have entered foster care. 36% of them are going to go to prison when they turn 18. It is a fact. 54% of them do not have a high school diploma. Less than 2% of them actually get a college degree. And in 2018, 88% of child abductions and human trafficking were kids out of foster care. So I'm encouraging everybody that looks like us to start really being a family, and if you can get your foster care license, do that. Because the health crisis that we're facing, and the reason why we don't have most of these seats filled, is because somebody went through foster care, they didn't get the services that they needed, and they were displaced as adults. Their mental health is off the chain. They probably have a lot of kids lost their kids, and because they didn't have allies that looked like them, their lives are messed up for the rest of their lives. And so my question to people on the panel is that, I was going to get to it, but you got to make a point. My question for the people on the panel are, what are you doing to stay culturally competent within us, not them, and not teaching them cultural competency, so that we are giving each other grace 99.9% of the time, and the rest of the time we're in therapy for the grace that we didn't give.
So this even goes, for me, this goes back to the question that you asked earlier. And I was thinking in my head, sometimes we don't even realize what folks are going through. You might have a mom come for that appointment. She can't ask her a question because she's worried about where her next meal is coming from. You don't know what her day has been to just get to go to that doctor's appointment. And the culture that I'm trying to create in my room, which is why this spot that I took my staff to is like a 5-star resort. but they deserve it because they're dealing with the hardest stuff in this world. And I had struggled with this idea of like our culture being this like family, but it is family. I work with 42 Black women, and I love each and every single one of them. And even when we disagree with each other in love. I lead with dignity, respect, and honor for them, so that's the culture of our entire organization. I literally had to let somebody go because they came in and thought they could come in like a hurricane. We don't do that here. We don't do we have titles, of course, like we know the org chart. I don't do hierarchical stuff. I told them we will all be program managers in here if y'all get to tripping about titles and stuff like that. And it has to be that way, because if we don't give each other grace, who will? If we don't look out for each other, if I don't take care of my staff and they don't take care of me, we'll crumble, and that means the 500 families that we serve won't get what they need. So those moms who are going through their lives just trying to figure out how they're going to make their ends meet, who are going from homeless shelter to homeless shelter, who need something and need support, we have to model, and it has to start with us. And it shows up with us giving each other an extending grace and not taking things always so personally, and maybe recognizing that you don't know what folks be going through. We might look like we got it all together, folks are really going through stuff, and I really want to encourage everybody to go to grief recovery. We offer grief recovery. Yolanda offers grief recovery. Like, that is going to be the start to heal our. You at grief recovery?
I'm with grief.
Okay, we got another one there. Like, this is going to be the start to really shift our mindsets and shift our community.
Can we have a next question, someone? Oh.
Yes. What I want to say, I want to first jump off of what you said, therapy. I'm a clinician who's also has physical disabilities, and I've seen it all. And the thing that bothers me most is our mindset. You know, when they put in like the jobs programs and different things like that, you can't just give somebody a job without changing their mindset. It all starts here. And we do have PTSD. It goes deeper than PTSD. It's actually more like complex PTSD because it's ongoing. It's all the time. We get it whether it's through seeing something or what we're thinking when we meet with that doctor, when we meet with that banker. It's all the time. And one of the things that we haven't done in a long time is come together as a family. You know, it's going to take us thinking of going back to the old school. You know, it takes a village. You know, there are things that have happened in the system that we have actually fed into. And it has taken us out of our game. And we internalize things differently than the book. You know, I heard a Dr. Love, she's explained it different. She said we don't have traditional PTA because of it being ongoing, and we are spiritual people. And it's all about wholeness and the piece that we're missing. And so one of the things we have to do is become empowered to be able to advocate for self. One thing that I learned with having this disability, if you don't know, you don't get. I have been trying to get a home health aide since September. I finally got it. And I'm a person who knows how to advocate. What about all those seniors, all those people who don't know, or even if they would do it, had the mindset, but don't know to do it? Okay. But we have to educate, and we have to educate as a community. I've been part of Hip Cuyahoga, and because everybody now is focused on systemic racism, okay? And they have this,
okay,
I just want to mention this last thing. Okay. They have an internal system to where, like when things change in one part, it'll go up, so you could see the progress in each system versus, and it's an easy something that we put in a computer system. So I
Okay.
just wanted to mention.
Thank you. So let me just say that, you know, we want to try to get everyone to ask their question. So instead of statements, so I know people have started making statements, but if we could have everyone just ask a question and then have one panelist address it because we are running out of time.
Hello, my name is James Rondell, and I lost both my parents during COVID, but really the question that I had was directed to Dr. Brown, and it relates to Black men, the health disparities, and so many other factors in the quality of life and the leadership of the home. What would you say are some of the remedies moving forward that we as Black men in America need to address?
I'm going to answer your question, taking back to the previous two. I'm going to answer your question with a callback to the previous two questions. Both questions were dealing with the emotional, psychological mindset that we as a people have. There's a part of science called epigenetics. What it refers to is how the external environment actually alters our DNA. Well, there are ways that we can actually change that. We call this intergenerational trauma. Because of the intergenerational trauma, African American men do not readily interface with the systems that govern us very easily. So Black men are most reluctant to come see a physician, so when they do, the problems that they have been far advanced. When they come in, I used to be upset. I am so encouraged now when a Black male comes in with his female mate, or even with his male mate, because some of them refuse to admit the symptoms that they have, whereas the partner will say he has this, and this. There are ways, however, to alter this mindset. One of the things, as the young lady referred to, there are meditation techniques where you can actually change your behavior and your attitude internally. We are so intent upon saying, I will. We make this declaration. However, in a state of consciousness that does not impact us on our ability to actually change. You have to do it in a certain kind of way. There are breathing techniques. That's the whole purpose of yoga and qigong. You have to alter your mindset internally first so that what you declare will actually have an impact on your behavior afterwards. And until we start teaching each other those kinds of techniques, Black men will still be coming in later than they should.
Are you accepting patients?
No, I don't. But I do put, when I used to give classes at the Cleveland Public Library, and at some point we will start those classes again.
Okay, so, you know, I've really been given the rap, and so, you know, I'm gonna turn it over to our president because, I don't know, maybe he can handle this much better than I.
That means she didn't want to tell y'all we have to wrap this up. But I do appreciate everyone again. I'm Kevin Hurd, the president of the Greater Cleveland Association of Black Journalists. We are overwhelmed by the information that we have shared here today. Thank you again to our esteemed panelists and our moderators. As our immediate past president, my good brother and mentor, Mr. Harry Boomer, always said, no one can tell our story better than we can. And I think this is an excellent example of that. I have to do some housekeeping. I'd like to thank, obviously, the East Cleveland Public Library for opening the doors to us today in this beautiful facility. Also, thank you to ClearSource. This forum, again, is part of the Connecting the Dots Between Race and Health, a project of Ideastream Public Media, funded by the Donald J. Goodman and Ruth Weber Goodman Philanthropic Fund of the Cleveland Foundation. We would also like to thank the Cleveland Guardians, the COVID-19 hesitancy team, and Famicos Foundation for their generous contributions. I also like to thank the specific GCLEABJ members who made this event possible, and of course, Rhonda Crowder, Greg Lockhart, Sandra Bishop, Stephanie Phelps, Tracy Cox, Wayne Daly, and Audrey Wiggins. Let's give them another round of applause. After the event, we have delicious sandwiches for you in the next room. Yes, we're going to feed you as well. And we have vegan. We have, I believe, gluten-free. Gluten-free. There you go. And we have some meat sandwiches too. All right, but thank you guys very much. All right. Oh, we have presentations. Panels, hold on. We have like cool things for you. And I'm supposed to be helping.
Thank you.
Stephanie, did she?
Make sure we get some photos.
She was on Zoom. Oh, okay. And Vicky too. Okay, so I hope there is.
And we also want to give a special thank you to Ivanka Hall, Executive Director of the Black Health Care. We thought about doing this project. Her name came up unanimously as someone we needed to have a part of it. And we reached out to her. She's helped us with the planning process. Ivanka, we have something for you. Just a small token of our appreciation. So that concludes our program for today. We do have lunch in the GCABJ room, and we thank you all for coming out.